Hello, everyone. My name is Dova Levin, and I am the National Senior Director for Education and Patient Programming at the Myasthenia Gravis Foundation of America. Today, we have a very exciting webinar. It is called MENMG Open. It's an innovative research study with a groundbreaking digital tool for myasthenia gravis. Our speaker today is Emma Tourecouk. She is a French pharmacist specialized in international clinical research. She began her career working in connected medical device development and joined Ad Scientium last year as an international clinical project manager. She brings her expertise in health tech clinical studies to the table in different diseases such as myasthenia gravis and setting up the MENMG Open Study. And Ad Scientium is a young French company created in 2013 based in Paris. The team is composed of researchers, data science engineers, user experience experts, interface designers, web and mobile developers, clinical project managers, and medical innovation specialists. They work together in synergy to develop the most appropriate digital solutions in collaboration with medical experts. So I want to certainly thank our sponsors today. Our national presenting sponsors are Alexion, argenx, and UCB, and our national sponsors are Horizon and Janssen Neuroscience. So I'm going to stop sharing, and Emma is going to start to share.
Thank you, Dova. Thank you, everyone, for joining today, and really thank you for having me. I'm really excited to be there today to present MENMG Open. So I'm going to present first my company Ad Scientium, a leader in digital biomarkers. Then I will present the MENMG Open mobile application that we have developed for research in myasthenia gravis, and then the MENMG Open study, which is a trial that started this year for GMG patients. And then this is really exciting for us. I will present the first results in exclusivity today of our analysis of the data that we have collected with the app during the first 6 months of the study. So to start with Ad Scientium, as Dora said, we are a French company. We are approximately 60 now. The company has been growing, and we work every day to move forward the following mission. We want to revolutionize the way to measure and predict the evolution of severe and disabling diseases, such as MG, or for example, also multiple sclerosis, using digital biomarkers to accelerate research and to improve patient care. This is really our motto, what we believe in and what we are working for every day at Ad Scientium. To give you a bit more detail, the digital biomarkers, they are physiological and behavioral objective measures, so measures directly measured from the body of patients that are generated by the patients directly, so they are not measured by a physician. And the digital biomarkers are collected, as their name is saying, by digital devices. So for Ad Scientium, we generally create mobile applications, but digital biomarkers can also be collected using connected devices, a computer, or even a tablet. Then these measures are collected, they are processed by algorithms that are developed by data scientists who are specialized in health. And then they are clinically validated in clinical trials against the standard evaluation, so we can ensure that the measures from the connected devices are really strong, robust, and safe. The goal by measuring these digital biomarkers will be to enable each patient to track their own health from their home by themselves whenever they want to, in between the visits to the clinic when they see their physicians. We also, the digital biomarkers also enable to monitor the patients in a more individualized way by using these algorithms, and to measure the symptoms, and ultimately to predict the disease evolution by getting long-term data. For example, over 6 months or 12 months, when you track a disease, you can eventually you will be able to predict what will happen the next day. Another important power of the digital biomarkers will be to identify new mechanisms of treatment effectiveness in real life conditions. For example, if you are trying a new drug for your MG, we will be able, by collecting digital biomarkers from home every day, to track and define precisely the effectiveness and the safety of the drug in daily life. Ultimately, this will lead to improving the patients' and caregivers' quality of life, and on a broader and longer-term vision to reduce the societal and economic impacts of the disease. At Scientia, we develop the apps. First, if we decide, for example, what has been done for MG to develop an app to help the patients, we will go directly to discuss with the patients and with the physicians that treat MG. To perform this and to know what should be in the app and how we can help, we conduct patient interviews to understand the needs that are specific to the disease in the daily living of the patients. And we will also provide and do rounds of testing. We do a first version of the app. We have some patients that are voluntary to test it. We collect their feedbacks. We improve the app. And then we do another round of testing, etc., until we define that the user experience and the interface of the app is really what corresponds to the needs that have been expressed by the patients. Of course, we will also work, and we have been working in the past 10 years with healthcare providers, with medical experts. They can be nurses, physicians, researchers, anyone who is qualified and interested to take part in a new project. We will collect information from them. They will also help us understand how the disease is currently, how the care is currently done, to understand the limits, and to identify leveraging strategies to support care pathways with digital tools, so generally with mobile apps. So just a conclusion on this slide, we surround ourselves with healthcare providers and patients so we can provide the best solutions possible, and we work in continuous improvement to do that. As of today, we have a rich pipeline of projects which are at different stages. For example, the scoping phase is the phase where we conduct the patient's interviews to define the content of the app. Then our developers will develop it. Then we have a phase of clinical research to demonstrate the clinical performance and safety of our applications, and then we will commercialize them, but ultimately all of our apps will be free for the patients to use. So as you can see, we work with many associations, with hospitals, and also with industrial partners to develop the apps. For example, for MG, MGFA has been really helpful with us, helping us to share the word about the testing for our app during the early stages of development, and MGFA patients have been really helpful for us to define the solution. So now let's go into the app. I'm really glad to present to you MeandMG Open. MeandMG Open is an application that we have developed internally, all the algorithms, the interface, etc., especially for research, for the MeandMG Open study. So what's in MeandMG Open? We're going to have 5 digital tests that you can do on your own. The first test is called My Eyelids. It aims to measure the severity of ptosis. It can be done every day. The second test is called My Breathing. It aims to measure breathing capacity. The third test is called My Voice, to measure dysarthria. And the 2 last tests measure the strength in the arms and in the legs. We also have digitized 5 questionnaires. So the questionnaires that you can find when you go visit your physician, or also in other apps, we have digitized them. A questionnaire about quality of life, a questionnaire about mental health and depression. The famous MG-ADL has been digitized as the My Daily Activities questionnaires in MeandMG Open. a sleep questionnaire to assess symptoms of insomnia, if there are any. And we have also implemented a scale to measure chronic pain. So I'm going to show you directly. I think this is always the best way to describe something, is to show how it works. So I have a quick video to show you what's in MeNMG Open. So during the trial, you will need to be registered and you will be given an anonymized credentials to log in into the app, because we are very much attached in every app that we do, every digital solution, to data privacy and identity privacy for the patients that will use the app. Then we can start. You can see the first screen, which displays all the tests and the questionnaires. It's very straightforward. Let's start with my eyelids. So it's a very quick test. It's approximately 1 minute. We will have a checklist to ensure that all the conditions are gathered for it to work. And then the app will take 3 pictures of your face, 3 selfies. Here you can see Mathieu, our president, being the star model for the demo. And the test is done. Then the algorithm will calculate the ptosis. For my voice, you will need to be seated quietly. The app will do a background noise check to ensure the performance of the algorithm. And then the principle is quite straightforward as well. When you are ready, you read the text out loud, the text that is displayed on the app. There are also different languages, if we need it, that we have tested internally. And then the recording will be analyzed by the algorithm to detect the onset of dysarthria in your voice while you are reading the text. For my breathing test, it's also quite simple. We also do a background nose check. Then you will have to take 1 deep breath to the best extent possible. You need to always feel safe while using the app, and then to say, ah, for as long as you can. The algorithm will measure the duration during which you have been breathing out, and this will assess breathing capacity. So you need to push stop when you are done. Then for the My Arms test, which measure the muscle strength, you need to be seated. The app will measure with only the smartphone. You don't need any accessories. The strength in your hands. So there will be audio instructions. You need to say which arm is the weakest, then hold the phone in your hand. And this is an algorithm we've been really proud of. The phone accelerometer can detect whenever you cannot hold your arm up anymore with the angle, and this will be the end of the test. Anytime, if something happens, you can stop the test and say why. Now for our last active test, that would be my legs test to measure the strength in the legs. This is what we call a sit to stand test. So for 1 minute, you will put, first we will put the smartphone in your pocket. So you will need pens with pockets to perform this test. And then you use a chair and you're going to sit up, stand up and sit down, sorry, as many times as you can, using your rhythm. There is no pressure. And the accelerometer in the app will also measure how many times you have been standing up and sitting down, and count this, which will give the strength of your legs directly. So this is our last test. You can stop it also anytime. And I can also show you an example of a questionnaire. Mental health. The questionnaires are very also easy to fill in. You just click on your answer and then you can move to the next one. All the questionnaires have the same presentation. So this is our MeNMG Open app. So now we can go deeper in what I want to present today, and a project that is very dear to us at Scientia, and also for me, the MeNMG Open Research Study. So we have started this study this year in March, and it will last until July 2025. We already have been enrolling patients that are actually using the app. We plan to enroll up to 500 patients with generalized MG, ACH are positive, and we work with a scientific board, which contains one expert per country. For now, we have Dr. Howard in the US, Dr. Carolina Barnett, which is also working with MGFA in Canada, and Dr. Sophie Lennerer in Germany. Ultimately, maybe we will open more countries if we have the opportunity and the possibility to do so. The particularity of this study is that it's 100% remote. This is 2023. We're working to really decrease the burden of clinical research on patients. So the principle is that you can enroll in the study and participate for a whole year without having to go to the hospital one time. Every follow-up visit will be done in a video conference using Zoom, for example, or with a phone call with the nurses from the CRO. The CRO is the company that handles all the follow-up of the patients for ME&MG Open. And the nurses are available anytime by email or phone call if patients have any questions or require any help. The study is remunerated, prorated on the number of assessments that are performed. And I'm glad to announce that we already, to this day, we already have enrolled 178 patients in the US and Canada. We plan to open Germany in November, so we can also have German patients. For this study, even if it's remote, it doesn't mean that it's a lighter study. We carry out everything according to the good clinical practice and the investigations on research for human subjects. So what are the objectives of ME&MG Open? We have three main objectives. The bigger one and the biggest challenge is to understand the patient's perspective in real life on MG, on their everyday life. We also want to explore the experience of the users with the mobile app and to identify levels of improvement that can be applicable to any digital tool or mobile application that will be used at home. How are we going to do that? So the patients that enroll in the study will use ME&MG Open for a whole year, mainly performing questionnaires, also answering questionnaires online, so they are sent via email or text. It's really, really easy to use. And we will also collect all the feedbacks from the patients that are given to the study nurses. And then what? We collect all this data, and every 2 months, we have a review of data. Our data scientists, biostatisticians are working to analyze everything that we are interested in knowing based on this data. And we meet with the medical board, so Dr. Howard, Dr. Barnett-Tapia, and Dr. Lennerer, with the Adsensiam team, to explore what is interesting and what we can valorize from this data, what we are learning actually from what is collected with the app. And then we will communicate, and we are starting, for example, today, of these results. So in scientific papers that we will also present in congresses. We'll also share the information among patient groups and also on social media. So to go a bit more into detail, what will happen and what is the patient's journey during the ME&MG Open study? The first step, of course, is to hear about the study, for example, today during this webinar, or you can see it maybe on social media, a post on LinkedIn, in a newsletter for a patient group that you are enrolled in. And then you will be redirected to the ME&MG Open website, which gives information on the app, on the study. You will be able to read our privacy policy. You will have any contact needed if you want to ask any question to the study team. And there is the eligibility questionnaire. So I'm going to directly show you the website as long as we're here. So you can see here all the explanation. There is also an FAQ. And most importantly, if you wish to participate, the eligibility questionnaire, It's really easy. It takes less than 5 minutes. You can answer every question. If you answer yes to all the questions, you will be able directly on the website to book an enrollment inclusion visit with a study nurse. This will take approximately 30 minutes, but if you need more time, the study nurses will always stay available to answer any question. The patients who want to enroll need to bring a proof of diagnosis. During this visit, to enroll, they will sign the electronic consent form using DocuSign. And then the nurse will assist them to download the MeNMG Open app, give them credentials to log in, the anonymized credentials that I've been speaking just earlier about, and then just show an overview of the app, like the demo that I have just shown you. And then this is the heart of the research. The plan is to use MeNMG Open once a month during a year, so to perform all the tests and all the questionnaires once a month, to be remembered, because we know it's not always easy to remember having to do that. Everyone can have very busy planning, so the app will send you push reminders, and we will also send emails or text to remind the participants when it's time to do the tests. And if it's not enough, the study staff can also call everyone, see how it is going, remember that it's time to do the test, and collect any problems that can prevent the participants to do their tests. There will be also online questionnaires approximately every 2 months. And the study team is available at any time by email or phone if needed. The patients will also receive a study newsletter, and they can access any scientific communications that will be written and created based on the data that will be collected. We have also our great study newsletter. Here you can see an example. Our designer has drawn our study team. You can see me here. We send it every 3 months. We are also very much on social media, so Instagram, Facebook, LinkedIn. The @Sensiam page can be followed. And we also organize webinars such as today with the Essential team, patient groups, and also with our medical experts. We will have many webinars to come until 2025. So now I'm really excited to show you the first analysis, the first results we have collected. So this concerns all the data that were collected on the app, with the app, during the first 6 months of the study. I really wanted to start with a testimony from a patient that has been really moving for our team, because we've been working on developing MeNMG Open since almost 3 years now. And so the first feedbacks were really moving to us. This is really important. And it was great to see this testimony about a patient saying that they are excited to be part of the research, about the fact that the data will be shared with the medical and research community, that also they think that using the app and answering the surveys is not tiring. This was a very great challenge for us. And just seeing that, you know, after enrolling, things are going well and the patients feel supported, and they find that participating is really useful. Okay, so let's go with the first data. So this data concerns 162 patients from the US and 11 Canadian patients. Why this difference? Because we opened recruitment in Canada after US recruitment. This is only why, but now we are recruiting more Canadian patients, and we are more than welcoming them. So what the research showed, we had a majority of female participants with 68% and 32% of males. The mean age of our study participants for MeNMG Open was 58 years old, and the mean age at onset of MG was 47 years. Also, 1 out of 4 patients are living with a caregiver. Almost all of the patients that are enrolled are under medication for GMG, but not 100%, as you can see. However, something interesting was that the patients reported that their satisfaction with the impact of their medication is a mean of 7 out of 10. So we can see that there is still improvement. And the fact that we will also monitor this data during a whole year of participation and during almost 3 years of study will give us the insight of the fact that the new medications that have been developed, the new drugs, very innovative by the new pharmaceutical labs, might improve dissatisfaction. This is what we would like to see. Regarding our MGFA class, we have a mix of different classes in our study sample, with a majority of patients with the class 3. We do not have any patient that is class 1 because ocular MG is not included in the study for now. Regarding the experience with the MeNMG Open app, this was also very great to see, and we shared this with the team that developed the app. They were really stoked. The satisfaction with the app is an 8.6 out of 10, which is amazing. The patients found an answer of 8.1 out of 10 for personal interest in using the app, which is honestly the goal, that people find it useful and they have an interest in using the app every day, every month, whenever they wish. This is very dear, and this is a great insight that we cannot collect during the scoping phase. And this was also the case that the questionnaires were really appreciated by the patients. This is what I can show to you now. We are working on a deeper analysis. We will discuss with the boards, and more data is to come. So I want to thank you for your attention. Thank you again, Dova and MGFA, for having me. And I think now we can go to the Q&A. If you wish to go to the website to register, you can click on follow the menmgopen.com address, and else you can scan the QR code directly with your phone, and it will take you to the website. And just for the Q&A, I need to tell you, if you are already enrolled in the study, you cannot discuss now with me directly, because I'm part of the sponsor of the study, but you can contact the study team to this email.
Great.
I leave the floor.
You can leave this up so people can
Yeah.
see it during the Q&A. We can leave this slide up. So we do thank you very much, Emma. That was very interesting presentation. We appreciate it. We do have a number of questions. So let me start. We have several questions about seronegative MG patients and whether or not they are able to enroll for the study.
Okay, so at the moment, we only enroll for the MeNMG Open study patients that are AChR positive. This is for regulatory reasons and scientific reasons for the homogeneity of the sample. However, when we will have validated our mobile app, we will make it available for all patients. So MuSK, LRP4, and seronegative patients. So this will just be, a matter of patience. And I wish we could have done otherwise, but we respect the regulation.
Okay, thank you. How can your app be used by low vision patients?
I think we have worked with patients that have a vision problem. But the main idea would be, if you are interested, to take the questionnaires and directly test the app with the study nurse. You can increase the font of the app if needed, and this is responsive.
If I'm in the study, should I be taking my medicine at a certain time or around the certain time that I'm completing the test?
Okay, no, there is no impact on how you treat your GMG. We will just observe your symptoms whenever you take the test.
Okay, perfect. And then where do I learn about the results of the study?
So the results will be sent in the newsletter. We will also publish them on the website. So the easiest way will be to consult the website. We also plan to be present at some congresses, and we will send the results to the association, so sharing them also with MGFA. If you are enrolled, you will get the data.
So we have another question. Can I share the data I enter with my neurologist?
No, the data cannot be shared with your neurologist. For now, it is not possible, but we are working or maybe finding a way to do this at the end of the study. So this is an answer that is for now, but this can be evolutive in the future.
Okay, perfect. Thank you. Was there ever someone is asking, was there any idea of tracking fatigue in the study?
Yes, there have been this idea. We've been discussing with many experts to include one fatigue questionnaire. And then, with all the results and the balance of what we made, the experts, we decided not to include the fatigue questionnaire. The one that was presented was MFIS-5. However, this is research. If we get feedback, that this is needed for many patients and realize this is needed, we can also include it. We are in a research phase and more than open to having the app evolve.
Perfect. The next question is asking, could you please elaborate on the way you recruit patients? Is it mainly through social media platforms? You showed on the patient's journey slide.
Yes, mainly with social media and also with patient associations such as MGFA. And also in some countries, for example, in Canada, we are going to display posters of the study with a quick explanation and the QR code at some hospitals that treat MG patients.
Perfect. The next question is, can you access your own algorithm data? Well, we already asked this. Is the data available to the patient or the physician?
No, not for now. MG Open is not an open source mobile app, but we are working on it. We decided not to put it in open source for now, but this is an idea we are thinking about.
The next question is, I know when you were showing the slide about how to enroll, they're asking, what do you need to prove that you have MG? What would you need to show?
Okay, you can give one lab result, or it can also just be a letter from your physician or even from your GP.
Okay, thank you. The next question is, will this app be available to neurologists for conducting virtual MG assessments of patients?
This version of the app is only for research. We are developing another version of the app, which will still be for the patients to use, but this version will be connected to a dashboard for the physician to see the results. But the aim of the app is really for the patients to use it by themselves. However, if they wish to be helped or they need any help by their physician, this is absolutely possible.
Okay. Are there any other questions that we have at this time? Oh, there's one. Any plans to include this app into future clinical trials for new MG drugs?
Yes, not the research version, but the other version, the complete one. We absolutely, the first step will be to validate our measures against the clinical standard, the same way you validate the drug. And then we have plans, and also we discuss with industrial partners to include our app in clinical trial. This is a great question, because for us this is an important part of what we do. Absolutely.
Perfect. Thank you. Do you want to just show the last slide one more time? So if
yes, the QR code.
Yeah. So we will have this webinar posted on our website for anyone that wants to watch it again, or if anyone that wants to see it who wasn't able to come, we will have it posted in a couple of days on the website, on the MGFA's website. So thank you very much, Emma. We appreciate your time. This has been a great webinar. So thank you so much, and everyone have a great day.
Thank you. Bye-bye. Have a nice day.
Thank you.